I'm Dr. Keith Kuhlengel, one of the neurosurgeons at Lancaster NeuroScience and Spinal Associates. My training began with undergraduate. I went to Bradley University in Peoria, Illinois. I was a major in biology, and I was able to obtain my bachelor's degree after 3 years, and I graduated summa cum laude. I then chose to enter medical school at Washington University School of Medicine in St. Louis, Missouri. I entered medical school in 1978. I found that the neurological sciences were my interest. Going into it, I thought I was going to be a primary care physician, but as I went through the initial classes and then went through the clinicals, I found myself attracted to the neurological sciences, and I found myself attracted to surgery. So I rotated through the various rotations and made my decision to become a neurosurgeon. I was fortunate enough to be able to stay at Washington University in St. Louis for my general surgery internship in 1982. And then in 1983 through 1990, I was a neurosurgical resident at Washington University School of Medicine in St. Louis, which included Barnes Hospitals and St. Louis Children's Hospital, among some other county and city hospitals that were affiliates. During that time, I was an NIN-CDS fellow in the neurobiology of spinal cord injury. I was able to travel for meetings, including in Sweden, to present my information that I have from my research. I then did my chief residency in 1989 to 1990 at Washington University and completed my residency June 30th of 1990. I then chose to come to Pennsylvania. I was an assistant professor of neurosurgery and of neuroanatomy at the Penn State School of Medicine at Milton S. Hershey Medical Center. And I was able to lecture to the undergraduate and to the medical students, and also perform clinical programs. And I was also the spine neurosurgeon for complex spine at Penn State Hershey. 1995, I was tiring somewhat of the political issues with academic health centers, and I had the opportunity to join the practice here at Lancaster NeuroScience and Spinal Associates, which I felt was an outstanding group of neurosurgeons and neurologists at the time. And I chose to locate my practice from the academic world of Hershey to the private practice world of Lancaster. And I've been doing that now for 15 years. I find that the Lancaster medical community is a very strong community. You have a number of excellent specialists. You have a very strong primary care network. You have outstanding hospitals in the region. I find Lancaster a very pleasant and very rewarding place to practice. For example, if I have a patient that needs an internal medicine or a surgical consult, I get a board-certified specialist or generalist see the patient rather rapidly and make the assessment and make the recommendation so the patient care can progress at an excellent rate. I grew up on a farm in southern Illinois, and at that time the most prominent people in town were the physicians. In fact, the primary care physician for our small town of 2,100 people was the most respected man in town. Growing up, I always felt that put him on a pedestal, and I wished to become similar to him. So when I went through college, I went pre-medicine. When I got to medical school, the question arose, what do you want to do that you're going to become a doctor? Because up to that point, I always wanted to be a doctor. Now suddenly I had this huge choice of what type to become. During the first 2 years where you have the classroom instruction, I found myself gravitated toward the neurological sciences. Neuroanatomy, neurobiology, neurophysiology. But my impression of what neurosurgery and neurology were at the time were very naive. When I got actually into the clinical service, especially neurosurgery, I found myself very satisfied with it. In fact, I was one of the few unfortunate ones, as my classmates would say, that there was a 4-week rotation of neurology and neurosurgery. Most students got a combination of 2 weeks and 2 weeks. Some had 4 weeks of neurology and no neurosurgery. They were considered the lucky ones. And I was considered unlucky because I got 4 weeks of neurosurgery. But on the other hand, it was a life-changing 4 weeks because I really began to understand what neurosurgery treated. Brain tumors, hydrocephalus, discs, spinal trauma, all things that I could really get into. Thus, in my 4th year, I decided to be absolutely sure that neurosurgery is what I wanted. I took a rotation as a sub-intern in medicine at the Veterans Administration Hospital. And then when I finished that rotation, by my second day on the neurosurgery rotation, I knew that that's what I wanted to do. I was fortunate enough to be able to stay at Washington University School of Medicine and do a neurosurgery internship, which was a general surgery base, followed by the residency, in which I also did a neurobiology of spinal cord injury spinal fellowship, which was supported by the NINCDS, so I actually was a research fellow during that. Did my chief residency there, and then came to Pennsylvania to start my practice as an academic neurosurgeon. I found that neurosurgery, with the diseases they treated, stimulated me. I think my background growing up on a farm, being mechanically oriented, was very helpful, especially in the spinal, which is the area of interest that I've developed. Neurosurgery is a large area. There are multiple different disciplines within neurosurgery. The two that I find the most fascinating are head injury and complex spinal issues. Most of my surgeries I perform are on complex spinal issues, ranging from cervical, thoracic to lumbosacral. I'm able to do decompressions, spinal stabilizations for trauma, tumors, degenerative disorders. I've also done some artificial discs in the cervical and lumbar region. In regard to head trauma, I'm involved in the LICAOC study at Lancaster General Hospital, which is a brain oxygen monitoring system. I've been involved in other brain injury studies earlier in my career when I was an academician at Hershey. So I think the head injury and the complex spinal issues are the two that I found most fascinating in the field of neurosurgery, and which is what I focus my time on. The most rewarding aspect of my work is to see the patient's response to my surgeries. Some of the most dramatic have been the trauma patients. You have a severely head injured patient comes in, they're on the verge of herniating, which can lead to brain death. You get the patient in the operating room in an expeditious fashion, do the surgery, watch them evolve from a deep coma to, in some cases, walking into your office and thanking you personally. That's very rewarding. Similarly, in spinal trauma, you have a patient that was doing a normal everyday activity up on a ladder, playing sports, and has a neck fracture, and suddenly you're quadriplegic. You urgently treat them with medications such as the Medrol, then operate to stabilize their spine, and to see them recover over time with intensive rehab is very rewarding. Also, just the simple ones, someone with a ruptured disc, which is causing severe debilitating pain, to be able to relieve that pain and have them tell you in the recovery room that the leg pain is gone. My back hurts, which I tell them to expect from the incision, but to have the leg pain, which has been disabling, to be gone that quickly is very, very rewarding. When I see a new patient in the office, what I try to do is let them talk and let them explain to me what their problem is, because often they will give me the information I need to accomplish and make a diagnosis. I try to treat all the patients how I want a member of my family treated. I want to understand their condition, and I want them to then understand what their options for treatment are. And it isn't always necessarily surgical. Many times we're able to treat patients with physical therapy, medications, injection therapy, and I discuss with them that surgery is often end stage. They are the ones, however, that determine when they are at end stage, that they can no longer deal with the symptoms, and they do want the more definitive treatment, which is surgery. And that is also when it's very rewarding, when I can give them a technically good surgery to accomplish the goal and get them back into life. I find trauma patients to be often the most challenging, both brain injury and spinal cord injury. You may at times have a patient come in that looks like they're devastated, that there's no hope, yet we give them every chance. You medically stabilize them, you get them to the operating room in an expeditious fashion, you do your technically best surgery. Then it's still, you have the intensive care period where you have to monitor their intracranial pressure, their sodium, their electrolytes, blood pressure, oxygenation, and a very intensive effort. And it may take days to weeks to find out if you've been successful. General advice to the patient, about whether it be any type of spinal condition or brain condition, is to exercise, to be active, to be challenged. And also, if they're overweight, which is very common in my population, is for a weight loss program, which they may want to work with their primary care physician to develop. Because the excess weight clearly puts extra stresses on the spine, which will advance degeneration and make recovery from any type of surgery more challenging. The practice of neurosurgery demands much time from myself, not only seeing the patients, performing the surgery, doing the postoperative care, but there's also paperwork and other demands in this day and age. To try to divert my attention and to give myself an escape, I collect antique tractors and agricultural artifacts. I grew up on a farm in southern Illinois. My grandfather had been a steam thresherman. My father talks about when he was a boy horse farming, and when he was 14 the first gas tractor came to the farm. Consequently, I've kind of gravitated to the teens and 20s of the 20th century for my interests, and I do collect and restore antique tractors. I find that the pursuit of a new tractor and then the restoration be two separate issues that really I enjoy. And to be able to show that and educate others into the history of antique farming, I find very rewarding